Welcome to YouTube viewers. Today we will discuss about sexually transmitted diseases. This is also called STDs. I am Dr. Prabhakar from Homeo Trends. 42 years of experience, and now we will see the images. Today we are discussing about sexually transmitted diseases. Among the sexually transmitted diseases, we mostly come with the HIV, AIDS, but other than this, it is a most dangerous disease. But there are many diseases which encounter with the sexually transmitted diseases. That is exposure with a infected person. Usually he gets infected. Among these, we see many diseases like chlamydia, gonorrhea, syphilis, so herpes and papillomavirus, even hepatitis. These are called the sexually transmitted diseases. These can be diagnosed by torch test. So among torch tests, we also get toxoplasma, chlamydia, rubella, gonorrhea, herpes. So all these together called the torch test. Apart from syphilis and gonorrhea, papilloma, hepatitis, these also comes under the sexually transmitted diseases. So people are generally, most men are aware of that they have contracted with a sexual disease because they get some problems like discharge, burning urination, pain, eruption, some problem with urination. So after exposure, that is intercourse with a exposed person. So likewise, they know that there is some problem with the case. Then they come to a doctor, then the doctor will further advise the investigations and it can be known with the investigations. So among these, there are many, as we discussed, there are many diseases. So these can be controlled if known early and treatment given perfectly, they will not reoccur again. So we will discuss about one by one. Among these, toxoplasma virus. First one is toxoplasma. This is also a sexually transmitted disease. So toxoplasma virus. This virus, persons will be affected mostly who have compromised immunity or weakened immunity system, especially like AIDS or any post accidents or weakened immunity system. This is infection with a parasite. It is nothing but a parasite. This will affect the persons who have compromised immunity or infected with other viruses. So thereby he also gets toxoplasma virus. Even blood transfusion, even organ transfusion, food infection by ingestion. So he may get this. With other viruses, when the body immunity is compromised, he is supposed to get this toxoplasma virus. So this is one among the torch tests. So other things we will see next. Second is chlamydia. Chlamydia is a second infection what we can see in the STDs, that is sexually transmitted diseases. This can be affected with a infection person, that is infected partner, woman or men. This can be this can attack both the persons. If one person is affected, the other person may also get through course. So the person affected will get a burning, redness, discharge, burning urination and fever and other symptoms like body pains. These things they may get infected. And especially if woman is infected, you may get problems in the reproduction. That is, it affects the uterus and it affects the ovaries, genital tract, and it can cause problems in the ovulation, problems in the reproduction, problems in the birth. So this is mostly called chlamydia infection, and this can be treated successfully with our homeopathic medicines. This infection is brought up with a intercourse, oral, rectal and vaginal intercourse. These can be affected with a infected blood discharge also. So this is diagnosed with a laboratory test and then we have to give the treatment. Next is gonorrhea. Gonorrhea is a also a sexually transmitted disease. It affects both men and women. When a person is affected, if she is a woman, she get a burning menstruation, vaginitis, cervicitis, uteritis, anything right from the infection can spread even to the uterus. She may get painful menstruation, burning menstruation, frequency of menstruation, and even abnormal vaginal bleeding and disturbance in the periods. These are the symptoms: backache, feverish, and even inguinal lymphadenitis and a greenish discharge like leukorrhea. These symptoms if a woman is affected. Suppose if the infected person participates with another person, he may get affected. If he is a male person, he may get a discharge, pain in the penis and rectum. Even during motion, he may get pain and frequency of urination, burning, and there is a greenish discharge, feverishness, and inguinal lymphadenitis, swelling in the lower abdomen, lymph glands. Even he may get fever, body pains. So all these symptoms because of the infection. If this infection may spread to testes, he may develop gonorrheal arthritis, what we call gonorrheal arthritis. And if the infection further spreads, it may spread to the joints, gonococcal arthritis. So different joints may be also affected with the gonorrhea. And the person who is infected, he will get the infection and symptoms within 1 to 3 weeks. So the diagnosis depends upon the swab culture. A swab, vaginal swab or a penis discharge swab that can be given in the laboratory, and with the laboratory the gonococcus bacteria is diagnosed. So this is the state of the gonorrhea. Trichomoniasis or trichomoniasis. This is caused by a bacteria called Trichomonas vaginalis. So it can infect both the partners, male and female. And if the woman is affected, she may get burning menstruation. There is swelling, redness, swelling, burning, frequency of urination, and other problems like white discharge. There is a itching and lower abdominal pain and back pain, fatigue and feverishness. All these symptoms she may get. And if the male person is affected, again frequency of urination, burning menstruation, and itching of the genital area, pubic area. There is a lymphadenitis and other problems like feverishness, fatigueness, drowsiness. So these all frequent problems he may get. Apart from that, there is a loss of sexual appetite because of infection, because of problems, and there is a loss of sexual appetite. And again this can be diagnosed with the swab culture. Take a swab and then go to the lab. They will test it and they can be diagnosed as a trichomoniasis. So this can be best controlled with medicines and antibiotics, but there is a frequent repetition with antibiotics. Whenever there is pain, problem, infection, if you take a course of antibiotic, it will subside, but again it will reappear, and it may last even for years together. So a constitutional treatment with right homeopathy will treat permanently. HIV infection, that is AIDS, again we can call it as a AIDS, acquired immunodeficiency. So this is also a sexually transmitted disease. It is a most dreadful disease of present era, and many people are suffering with this problem all over the world. So, and it is mostly dreadful disease, what we call is a dreadful disease. If a person is affected with this and his body gets weak immunity and the immunity is compromised, slowly he is getting weak and weak. There is a weight loss, fatigue, sore throat, urination problems, feverish and weight loss. These are the symptoms. So if it progresses further, there is a weight loss, continuous fever, may get lung infection and cough, persistent cough, and there is a body pains, bone pains, weight loss. All these symptoms lead to further damage. So this is best treated nowadays with right homeopathy, and it can be controlled to some extent, not totally it can be cured, but it should be under control. Now there are many medicines with the research in homeopathy. We have proved it. Many people are using it, adopting it, and getting good results. We can have good scope to treat nowadays HIV cases with follow-up with the CD4 counts and their immunity bladder tests. All these HIV tests have to be done, and further follow-ups to be seen with improvement. And especially homeopathy does help in improving the body immunity, and further infections are prevented, further immunity can be improved, their CD4 count can be improved, their hemoglobin value can be improved, their lifespan can be improved, along with the other management techniques. Genital herpes. So it is nothing but herpes, HSV1 and 2, herpes virus, what we call herpes virus. When the infection is caused or exposed person, when there is a contact with the exposed person by oral sex or anal sex. So the person can be infected with oral herpes or rectal herpes or body herpes or vaginal herpes, anything. So infection can spread through contact, through discharge, through chronic contact, through vaginal discharge. This can be spread through the seminal, liquid, even these fluids, sexual fluids. So it can also spread through blood infection. That is why you should be very careful with these persons. And whenever a person is affected, he may get within 1 week or 10 days a small eruptions on the penis or vagina or oral cavity or rectum area or buttocks area, thighs area or lower pubic area. These eruptions, they spread and they become like ulcers or pustules, and they ulcerate, they bleed, they can have discharge, and they become very bigger in size, and may go even with a little antibiotic. After a course of therapy, they may vanish, again reappears. So recurring eruptions, we have to think of the infection. So further, there is a burning micturition, feverishness, fatigue, shortness of breath, weakness, recurring stitching type of pains, and very painful ulcers, and even eruptions with severe pain, nightly sweats, exhaustion. These all things we get in the herpes system. And it may be, if it is tested, the blood is tested for torch test or HSV test, IgG, IgM, they may be positive. So depending upon that, we have to diagnose history as well as the test. So these HSV cases, especially herpes virus cases, they may go with or without treatment, and they tend to repeat chronically, and even years together they suffer the person, and the person he cannot tell to other persons. It is a very silent disease, silent killer. So you should be very cautious, and there is a good treatment with homeopathy in the chronic constitutional treatment with 1 to 2 years. If the patient continuously takes, definitely it can be reduced, and either his IgG levels, IgM levels have to be monitored with the frequent blood tests, and either body weight and other general conditions will be improved, sleep will be better, pains will be better, and further complications can be prevented with the right homeopathy. HPV, human papilloma virus. There are 16 types of human papilloma viruses. This will cause different types of warts, what we call warts. And there are 16 types of viruses. They cause different types of warts. These warts can be especially in the genital area, or skin, or face, or lips, or arms, axilla, anywhere it can be. Especially this is due to chronic contact, or maybe sexual contact or limited contact. So closed contact, any closed chronic contact will spread the infection, and that wart tend to grow further, and even if you cut or with a caustic or chemicals, again there is chance of reappearance. So with the right homeopathy, this can be treated permanently. There is a good treatment for human papilloma viruses in homeopathy without any side effect and without recurrence.